programs for SID-W. So first and foremost, I know we have a very packed agenda, so I don't want to take up more time, but I just want to quickly thank all the speakers for participating in today's event. I know it's not, we're going to be going pretty quickly, hence lightning talk, but we appreciate you sharing your thoughts on this really timely topic. I also obviously want to thank those who were working behind the scenes with us to help put this event together. So I'd like to thank our workgroup co-chairs, Laura Ho and Stephanie Vasquez for the Health and Nutrition Workgroup, and Erica Holzabel and Josh Mendel for the Monitoring and Evaluation Workgroup. So thanks to the four of you for helping to put this together. We really appreciate it. And with that, I'm going to hand it off to Samantha, who is our moderator for today's event.
Thank you very much. Hello, good morning, good afternoon, good evening. We're glad that you're here for this event, a year into COVID-19, transformation and best practices in MEL. We've got really great speakers today. It's going to be rapid, it's going to be quick, but we think it's going to be a great opportunity to get a broad view into a lot of amazing work that's happening worldwide. I am a learning advisor for the Knowledge, Data, Learning, and Training contract for the Bureau for Resilience and Food Security. I'm glad to be here as your moderator. A couple of quick notes. As you can see in the chat, please do note questions you have for the speakers in the chat. We'll have a couple of opportunities for Q&A in the middle of the program and at the end of the program. We'll get to as many questions of yours as we can. We won't get to all of them, but hopefully speakers might be able to also answer some after the call's over. I also wanted to note we're not going to be sharing slides during this presentation just because they are very rapid, but we will be putting together a package of materials to share out afterwards so you can learn a little bit more about the programs and efforts that have been discussed today. So we look forward to jumping in. With that, I'm going to hand it over to Erin Roesch, who's a senior policy analyst at the Office of Policy Planning and Learning, or PPL, at USAID. Erin, we welcome you and thank you for kicking us off.
Great, thanks, Samantha. I'm really excited to be here and to have the opportunity to provide some opening remarks this morning, and of course to hear from all the presenters later in the program. So as Samantha said, I'm Erin Roesch. I'm with USAID's Policy Office in PPL. And in my few minutes this morning, I wanted to just share a little bit about how we've been thinking about adaptation from a policy perspective at USAID, what we've been learning and what that may mean for the future of our work. So I'm going to focus a little more on the how rather than the what. And in particular, I'm going to talk a little bit about a strategic review we did over the last several months called Over the Horizon. This was an agency-wide review that sort of looked across geographies and across sectors. So as many of you may know, USAID stood up a COVID-19 task force relatively early in the pandemic, and that was really focused on managing the immediate response and many of the operational challenges. But I think we also early on recognized that in many ways this was sort of a triple crisis, right? That at least from our perspective at USAID. So there was the immediate health and humanitarian crisis, of course. There was a really significant operational crisis for us as an organization, for our implementing partners and other partners around the world. But it was really also, I think, a wider development crisis, right? Like, I think across sectors, across regions, there's really no area that was untouched by this crisis. And I think in many ways, what we were seeing was a fundamental reshaping of the development and humanitarian landscape. So Over the Horizon was meant to complement the work of the task force by sort of helping us kind of grapple with that as much as we could in the moment and begin to plan for the medium to long-term implications of COVID and everything that all the second order impacts. So I'm going to focus on sort of one particular aspect of that, which was the first kind of corporate agency-wide scenario planning exercise that we've done. I could easily spend the whole session describing all the different components of it. It was sort of a multi-part process, but I'm going to try and do a pretty quick but a slightly deeper dive on the scenario planning. So just by kind of way of overview, the scenario planning exercise was something we did relatively early in the process to help frame everything that followed, including setting objectives and making a whole series of recommendations. It was done totally in-house by Usaid staff. In total, something like 75 technical experts from across sectors participated in that. And the goal was really to develop pretty clear, specific, relatively succinct scenarios over a 5-year time horizon based on high impact, high uncertainty trends that were reshaping the development landscape. So to do that, we split into 5 teams. Each team focused on a different megatrend that we had identified earlier in a rapid fire landscape analysis. So one was focused on kind of broader national security and geopolitical implications, one on the health crisis in all its dimensions, one on the economic crisis, one on rising pressures on governance, democracy, and stability, and then one on compounding household shocks. So rising poverty, food insecurity, gender-based violence, lost educational opportunities, et cetera. And so each of those teams had sort of a basic template and some guidance, but was also given quite a lot of discretion how to approach the task. Some reached out to external experts and involved them in the conversation. All of them drew on different kinds of data sources. But the core of that and really the start of the process was a sort of a brainstorming session and an enumeration of drivers. So basically the forces that we saw that were reshaping the challenges and opportunities that we face, but around which the outcomes were highly uncertain. And so we distinguished those. We also listed, but distinguished those from assumptions, which could also be high impact, but around which we thought there was relatively more certainty. And so then once we sort of came up with this long list of drivers, the next task, which was by far the hardest part of the exercise, was narrowing down to 2 and identifying the top 2. And that was, I think, difficult because there were so many interrelated forces that we were seeing, but it was also, I think, a really important part of the exercise in that it helped us kind of simplify the world and what we were seeing. And so with those top 2 drivers, we arrayed those on a 2x2 matrix. So to come up with kind of a best, worst, worst, best, and worst case scenarios, and then develop little vignettes for each of those that kind of teased out exactly what we might see in each of those cases. And then each team also had an option to maybe overlay a 3rd driver to add some nuance to that. So for example, the health team, the 2 drivers it identified were, one was the resilience of country health systems in managing COVID and other related demands on the systems, and essentially whether they would hold up or begin to fracture. And then a second driver was the potential emergence of new disease outbreaks over the coming years, and how those could interact with COVID and how they could strain the systems. And then the health team sort of took that option to do a 3rd overlay, which was really focused more on the vaccine. I think there was even then early in the process, there was, I think, fairly good confidence that there would be a vaccine, but I think a lot of uncertainty about the timing with, at which it would get rolled out, particularly to low and middle income countries. And so that kind of split out the scenario. So all told, the 5 teams developed 31 distinct scenarios. We then distilled that down a little bit to 15, so 5 worst case, 5 hybrid, and 5 best case. And then behind all that, there's something like 200 pages of analysis that we put together. But kind of more than the what of that, I think I wanted to highlight some aspects of how that was useful in the process. So I think one lesson that we took was that just having a really systematic, structured process to kind of help us think through and what we were seeing and talk through it was really useful. I think in that sense, the process was as important, if not more important, than the product. And I think it also just, even as we use the scenarios in the rest of the exercise, just having that kind of collaborative level setting brainstorming process was really useful kind of as a broader group. So, looking ahead, I think, as I mentioned, over the horizon, it ran for several months over the summer and fall. I think we've been thinking about implementation and the ideas to inform strategic pivots for USAID moving forward in the medium to long term. As you know, we were not only doing this in the midst of a global pandemic, but also in what turned out to be the midst of an administration transition. And so there, just to be candid, I think there's some things that remain TBD about how that gets implemented as our new leadership comes on board and sets the policy direction. But I think, there's no question, I think, from where we sit in PPL that we can't just go back to the status quo ante, that, some things have fundamentally changed. And so just to highlight a few of the things that we're thinking about moving forward. So first, I think the whole exercise put a finer point on the need for coherence, for policy coherence. The interconnections among the challenges that we're seeing are profound and unavoidable. I think we're really seeing overlapping compounding shocks. And so in turn, I think we also have to be more serious about thinking about how our efforts sequence and layer and how they aggregate up to and what their aggregate impact is. I think second, we've really realized the need to strengthen our strategic foresight capabilities. Scenario planning is just one example of that, one tool in that toolkit. I think in many ways that a pandemic would happen was actually pretty predictable and was in fact predicted by many, even if the timing wasn't uncertain. And yet I think we weren't especially prepared. And so I think building up those capabilities like scenario planning, like horizon scanning, like forecasting tools, but as important as building them, I think integrating them into our policy planning and everything that flows from it is really important. And then last, I think our watchword throughout Over the Horizon was humility. This is an exceptionally complex and uncertain moment. And I think, so I think one thing we're thinking about is how do we institutionalize practices like pause and reflect moments, like, making sure we're questioning our assumptions, that we're looking for data when we have it, but also recognizing the limitations of data and the questions that it can't answer. And just generally being clear and honest and upfront about what we don't know. And so I think instilling those principles in our work moving forward is going to be really important. So I'm going to stop there. I really appreciate this opportunity to share some of that, the Over the Horizon exercise and that experience. Really looking forward to the lightning talks and the other speakers today. And I'm certainly happy to answer any questions that you may have. Thanks.
Aaron, thank you so much for providing that overview. Really appreciate you giving a little bit of a picture of what it was looking like at PPL and the work that you were doing with respect to scenario planning and thinking about ways forward. With that, I'm delighted to ask Catherine Nguyen to please kick us off with our very first lightning talk. Catherine is a Global Development Associate at Frame. Catherine, please begin.
Hi, I'm Catherine from Frame. Like Samantha said, I work at a technology company and US certified small business. And I primarily focus on engagements in monitoring, evaluation, and learning. So I'll be explaining how machine learning can enable us to harness the wealth of information that's already available, an ability that has far-reaching implications for MEL both during and long after the pandemic. So in this sector especially, COVID-19 necessitated creative approaches when it came to localized data-driven decision-making, and that's exactly the type of situation we're designed for. So at our core, Frame generates actionable hyperlocal population information for difficult to access places. And when data needs expanded and collection ability shrunk with the onset of COVID-19, we recognized the life-saving impact that our software could have, and we distributed data free of charge to responders worldwide. And to accomplish this work, we use machine learning to enhance existing data sets. So our models weave together professionally enumerated household surveys with remotely sensed data, and that produces high-resolution heat maps of hundreds of population indicators. And in the context of COVID-19, these enabled policymakers, responders to quickly quantify an individual community's vulnerabilities and resources at the square kilometer level. And this was all without putting enumerators and respondents at risk conducting surveys or traditional data collection. So for partners I talk to in the MEL sector, the ability to leverage existing data sets in this way will continue to prove invaluable as the risk of COVID-19 persists and beyond, because existing data sets whether baseline conducted at the start of a project or a large household survey implemented every 5 years, they all still have insights that we can continue to unlock outside of their original purpose. And at Frame, our software is that key. So our software opens up a world of localized data that transforms our partners' impact.
Thank you, Catherine.
Yeah.
Very well done. Much appreciated. I just want to remind people, please do put your questions in the chat. As we go, we'll be breaking about halfway through the presenters for some Q&A. With that, I'd like to please welcome Lemlem Kabeda. Lemlem is a monitoring, evaluation, accountability, and learning technical specialist at World Vision Canada. Lemlem, welcome.
Thank you for having me. World Vision Canada has deployed a range of options for monitoring and evaluation data collection. Where the COVID prevalence and country restrictions are high, we try to use secondary data. And in other places, we use virtual or face-to-face in-person data collection with COVID protection protocol in place. To give an example, for our recent DRC baseline survey, we trained local MNE staff, pre-tested the data collection tools, and provided feedback all virtually from Canada. And in DRC, for the enumerator training, we provided hand washing with soap, water, masks, and sanitizer at the training center. And enumerators' temperature were checked before entering to the training room. And large windows were open with fan running to ensure that air circulation is happening. And data collection was done outside with enumerators wearing masks and keeping their 2-meter distance from interviewing. And we were able to track the data collection live from our server as enumerators use ODK for data collection. And some of the challenges were unreliable internet connection. And we couldn't refine some of the data collection tools if we have a chance to directly communicating with the team and study participants. And to give an example for virtual data collection, we are preparing to evaluate the youth empowerment training in Latin America. Since COVID hit, the youth empowerment training is shifted to the blended approach, where the first few sessions was conducted in person, while the most sessions are using online platforms, including Zoom, Google Class, and our own use-ready mobile application. So for this data collection, we will distribute the questionnaire directly to youth participants so that they can fill and provide feedback. So overall, World Vision Canada is adapting the MNE system to COVID, and we are setting up a real-time activity tracking tool where project officers can immediately report as soon as they finish their project implementation, and that data can be transferred to Power BI, where we can see real-time data, and that will inform our decision-making. Thank you.
Lemlem, thank you so very much for sharing about what you are working on. Really fascinating. I see there's already a couple of questions in the chat. Please do keep them coming. With that, I'd like to please turn to Lauren Serpy. Lauren is the Deputy Director for Results and Measurement at PACT. Lauren.
Hi, everyone. Good morning. Good afternoon. Thank you. So I will present about how some of our peace building, monitoring, evaluation, and learning teams, primarily in the Horn of Africa and Nigeria, have adapted during COVID. So some of the challenges they faced and some of the positive unintended consequences they're seeing and lasting legacies of this adaptation. So these projects were already quite flexible and adaptable, given the complex operating environments in which they work. So their MEL systems already had flexible methods built in, methods and approaches built in. They obviously needed to modify data collection tools and indicators, and when they were already not using virtual data collection, they had to switch to that. So partners needed, our local partners needed capacity development in using secure virtual platforms, understanding the difference between the platforms, given the very sensitive nature of the work. So we were helping provide them with the landscape of those and the different security features of each. Some positive unintended effects of this adaptation during COVID have been, it really accelerated our capacity development of partners to lead data collection efforts. So both in technology, as I said, and in methods. So an example, instead of a Nairobi-based team going to the field to do outcome mapping data collection, they remotely trained field teams to do the frontline data collection sort of faster than they would have done that before. And then those teams that were involved in the outcome monitoring, outcome mapping monitoring efforts, they were also able to be quickly leveraged to tailor the peace messages that they were also bringing along to have COVID awareness messages. Some challenges that our peace building projects have met so far, we've had to rely on speaking with our NGOs and CSOs as proxies to represent the communities. These are largely oral communities, so we haven't been able to talk directly with communities. We've had to do more frequent data quality checks with partners and more frequent check-ins. And we've also had budget implications, budget increases for Mel. Thank you.
Thank you very much, Lauren. I appreciate your contribution. We have one more speaker in this section, that's Ban Tabara. Ban is the Monitoring and Evaluation Manager at the International Rescue Committee in Lebanon. Ban, are you ready?
Yes, thank you. Hi, everyone. So the IRC conducted gender-based violence risk assessment to capture the specific needs of vulnerable girls between 14 and 18 years old during the COVID-19 pandemic. These assessments found that incidents of violence within the household of vulnerable girls increased. The main perpetrators were their primary caregivers, so which shows the increase in domestic violence. And in the case of early married girls, violence was perpetrated by their husbands. There was a significant increase in the intimate partner violence. So the adolescent girls taking part in the assessment expressed that having access to regular communication with the IRC frontliners, especially through psychosocial support sessions, had been life-saving. So since this was the only opportunity for these girls to access support, the need to adapt the Girlshine PSS package to be delivered remotely through WhatsApp was essential. In terms of M&E, a facilitator's notes report is filled by the facilitator at the end of each session to organize the work by assessing and documenting it. Also, the girls get the chance to evaluate each session by simply sending an emoticon feedback on their view of the session. Actually, M&E tools were adapted in a simple way, avoiding the regular pre and post test to measure just the increase in knowledge. Instead, the team conducted monitoring and quality checks to assess the satisfaction and recommendation of the girls. And positive feedback was received on the content and the relevance of the sessions. This feedback was collected either through individual surveys with randomized number of girls or through focus group discussion at the end of the cycle. Of course, the surveys or the FGDs are not administered by the facilitator to avoid any subjectivity. Also, some questions about safety were asked, and almost 89% of the girls reported feeling safer and being able to make decisions about their safety at the end of the adapted Girlshine cycle. Actually, the implementation was easier than we thought. We thought that it would be complicated, especially through WhatsApp, but actually the girls had some experience in WhatsApp and they were very responsive and satisfied for receiving this package, especially during this challenging time. We still faced some connectivity problems, but we were able actually to distribute some phone recharge cards so the girls can attend the session. And this was a successful implementation through a virtual platform. Thank you.
Very well done. I just want to thank our speakers. They are doing an amazing job keeping to time, so much so that we have a couple extra minutes for Q&A, which I'm really delighted to be able to have. So I'd like to ask Paul to please spotlight our first speakers, Aaron and the 4 lightning talks, and we're going to send some questions your way. All right, wonderful. The first question is for Aaron. You might have seen it in the chat. The question is, how do you see the role of integration tools in making existing data used and useful for USAID PPL? One of the problems we've noted is that a lot of interest data exists, but it's hard to access or others don't know it exists. In your response, Aaron, I'll ask you to be brief so we can get to their questions, but please feel free to go ahead and provide your response.
Sure. So I think actually one of the other aspects of Over the Horizon that I didn't have time to talk about was we had worked quite closely with the COVID task force that I mentioned to create a kind of an internal dashboard of different data sources that was on our intranet that sort of used Tableau essentially to kind of visualize a lot of the different, particularly I think some of the new data sets that came up that were tracking the impacts of COVID. So that I agree that this is a real challenge. I think that was one thing we tried to make data accessible, but I think really then integrating it in a useful way is, I think, the bigger challenge. And also I think one thing that we noticed and continue to struggle with is sort of how to avoid kind of a salience or measurability bias, where we're sort of focused only on the things that we can measure or that there is new data against, and not so much on the things that are harder to measure, particularly in sort of a rolling crisis. So, I think we've tried to make data accessible to everyone, but it's still kind of a work in progress in how to use that to continue to inform policy decisions.
Thanks, Erin. That's great. Lauren, the next question is for you. Can you please elaborate a bit more on the steps that were taken to ensure and assess data quality?
Sure. So some of our projects, so basically reported that they were doing more. So we work through local partners, local CSOs. They were doing more frequent check-ins with them to ask them about their plans, to ask them for source documents. They were also asking them to do more advanced planning for some of their activities and submit plans to us in advance, whereas we wouldn't micromanage that much before, but just so we had opportunities to like join remote sessions to make sure that they were occurring and that there were the amount of participants there that they reported to us as attending, things like that. I know that projects have also set up things, really simple systems, but for the MEL teams to do like rapid checks for data that's coming in, just if anything sort of looks out of the ordinary or out of different than what we had expected, any sort of outliers, that sort of thing. So just more effort was put into, I think, more of that frequent ongoing check of data quality, whereas before we would do more infrequent like visits to partners and things like that. So I think that was a bit of the procedures that the projects took.
Thanks, Lauren, for providing a little bit of that extra input. I also just put a note in the chat. Please do add any other questions you might have in the chat so we can answer them during this Q&A. All right, the next question is for Catherine. Are there resources available to learn more about the ML application?
Yeah, we have a website, frame.io. I think I also sent along some information that's going to be included in a packet after this of resources that has a few slides that went over our COVID-19 work and then just our general methodology. And for any MEL questions in particular, I'm available too for any of your more specific questions.
Thank you very much, Catherine. Another question for Erin. Could you please talk a bit more about the status of Over the Horizon implementation? Has USAID begun to work on identifying pivots in the focus countries identified in December? Or is this all on hold pending guidance from the new administrator?
Yeah, thanks. So I think, the short answer is, so Over the Horizon was fundamentally an analytic exercise and was making recommendations for the kind of medium to long term. And so that, that analysis we're continuing to work on and to integrate and I think will be part of our planning moving into the future. But as I said earlier, we are, new leadership are coming on board. Many of them are not on board yet. And so I think we are waiting for their guidance on broader implications. I think there's no question that this analysis will be used to inform where that goes, but on sort of elements like focus countries, I think we're kind of getting them up to speed and getting their steers, and I think more to come. I think the other thing that we've recognized is that many of our USAID field missions have gone through a pretty rigorous strategic planning exercise over the last year. They're also overwhelmed dealing with COVID, so we certainly don't want to burden country teams with more work until we know exactly where the priorities will be.
Thank you very much, Erin. All right, last call for any questions. If you can't use the chat for any reason and you'd like to simply unmute and ask a question, please feel free to do so at this time. All right, I want to thank this first group, but don't worry, participants, you'll have a second chance to ask these folks questions after we have the second round of lightning talks. So thank you, Lauren, Bon, Lemlem, Aaron, and Catherine. And with that, I'd like to please ask Achal Chand to join us. Achal is a nutritionist with the World Food Program in South Sudan, and she's going to kick off our second round of lightning talks. Thank you.
Thank you very much. So WFP in South Sudan runs quite a large treatment of acute malnutrition program. We reach about 1 million women and children across 1,200 sites. South Sudan is already a really complex operational context with conflict and insecurity, with geographical access constraints, with a limited availability of health services, and a high turnover of staff. So with COVID-19, implementing nutrition programs in the field became even that much more complicated. We did 4 key things to ensure program continuity. The first one was to ensure that programs were adapted. So we adapted admission and discharge criteria. We changed the schedule of our distribution days to reduce crowding and contact. Then we greatly strengthened the role of community nutrition volunteers. We trained and equipped them so that they were able to continue screening and provision of messages at the community level. With our partners, we ensured that we topped up funding to the partners so that they were able to put in place hygiene measures, they were able to ensure physical distancing, and finally to have an oversight on how programs were being implemented. With our inability to do face-to-face monitoring, we switched to the use of mobile phone technology and community feedback hotlines. So in all of this, there were 2 big takeaways that we learned. The first one was that community nutrition volunteers are really key to ensuring program continuity. They come from the community, they have the trust of the community, and if they are equipped and trained in the correct manner, they can ensure malnourished mothers and children are screened and referred in a timely manner to a nutrition center. And secondly, we learned that the use of technology in monitoring is only as good as the coverage of technology. So in a country like South Sudan, where mobile phone coverage is less than 30%, because we couldn't do face-to-face monitoring, we had to switch to mobile monitoring, but that meant that we really could not get to most of our sites, especially in the hard-to-reach areas, in the remote areas where there was no connectivity. So moving forward, one of the things we are looking at is potentially putting in place a system of having community-based monitors so that we can have a constant flow of information in the absence of being able to use technology. Thank you.
Thank you, Achal, very much for sharing that insight with how you're evaluating your programs and making adaptations. With that, I'd like to please go now to Kahelo Lekalakala, who's National Program Manager at PACT in South Africa. Kahelo.
Good afternoon. GCBS, Government Capacity Building and Support Program implemented by PACT in South Africa, had challenges with a lockdown introduction. So what we did is, because our main form of intervention is field work, we had to switch quickly into remote services for our beneficiaries. So how we did that, we had to put forward resources for our social workers and community caregivers in the form of more airtime, more data, and then also developed quickly remote counseling case management guidelines to make sure that they have resources that they can use on the field. We developed referral lists, training. We did a lot of training for our workers to upskill them for COVID and for key counseling skills. And then we empowered supervisors to provide debriefing for our workers as they did a lot of counseling on the phone and with all the changes that were impacting them on the work. And our focus was mainly on children living with HIV, healthcare for COVID risk assessments to empower our communities, and also looking at child protection for GBV that was in the rise. And then we also had to look at issues around how best to develop more tools that can help our workers. So we had a very clear case management process where we developed administration tools that included service records, process notes, referral log, call tracker, and then we also had support tools that we developed looking at COVID risk assessment, family risk assessments on socioeconomic factors, and another referral form, and also GBV or child protection incident reporting. So the achievements were that we're able to have continuous service for our beneficiaries. We did have challenges on this. The challenges were that some of the information was not easy to get to some of the beneficiaries because the contact details on files were not correct. So that was a problem. Offices were closed and we had to adjust in different ways of working, and there was fear and uncertainty, but we had solutions. We had partners, we were working with other organizations, we were working with social behavior change records that we had that had attendance registers that helped us. But one of the key things that we use Zoom training for our workers, and also using bulk messages for our clients, and also digitizing some of the programs that we have for our communities, continued training and partnerships. Those were very key things that we use to make sure that we are able to reach out to those beneficiaries across the country, because most of our beneficiaries have cell phones. That was a key tool that we used. Thanks very much.
Kahela, thank you so very much. I'm hearing some themes in what people are sharing in terms of some of the really important pivots people have made with respect to the changes wrought by COVID. All right, moving on to Mike Klein. He's the Director of Development at IMC Worldwide. Mike, glad to have you.
Great, thanks so much. I think one thing that's clear, and I think we've all lived this now, is the importance of existing data in a crisis context. So in the case of COVID-19, with restrictions on travel and people able to move around and collect new data, existing data that we have at our disposal becomes even more important. So I think back in March, we saw I think it was an ICT Works post with something like 150 new data tools that we're working on collecting or using data to be able to inform MEL programming related to COVID-19. That's a lot of tools. And so we undertook a program on behalf of SCDO called COVID Action to really do some sense making there and attach some concrete funds to kind of supporting some of the best tools. And so that was in March. We then went in to award 12 grants and create kind of a portfolio of what we saw as kind of best in class existing data tools with existing data sets attached to them and kind of mature audiences using those tools and do sense making within the community itself, so that people were using good informed tools. So one of the tools that we have sourced and are putting out in the world, I just provided a link to here, is Sergio Ventures, the Risk and Vulnerability Index, which takes existing data that is already being collected or has been collected across a range of data sets and then makes it available in a useful format for people, MEL practitioners and others, to think about kind of baseline data for COVID, risk and vulnerability to COVID. This is across Africa, so a total of, I believe, 48 separate countries are able to pick up and then use this data. We've had buy-in from Usaid's DataFi program, GPSTD and DIAL and others that are using lots of other tools that we have that we've sourced as part of the COVID Action program as well. So happy to provide any additional guidance on kind of what that portfolio looks like. In addition to that, how you can create a healthy data ecosystem and draw on some of these existing tools that people have been using. Over.
Mike, thank you very much. Okay, moving on to Lotta Sandin. Lotta is a senior learning advisor for the QED group based in Egypt. Lotta, over to you.
Thank you. So my perspective here is basically talking about can implementing partners and the mission walk the talk of CLA? So we here in Egypt, we organized a learning event not long ago for implementing partners, for all the implementing partners in Egypt and the mission about were there any substantial adaptations, and did they do any substantial adaptations to programming due to COVID-19? And of course there were. 85% said yes. They had to adjust the targets, they had to do changes in the MEL plan, of course, and they had to do shifts in programming. And after all this, there were basically 4 main lessons learned. We could see, and the implementing partners and the mission verified, that if you have a learning organization in place from the start, shifts like this are fairly easy to do, and you can shift quickly. If you have the processes in place, if you have a processes for adaptive management in place already, it's easy to just move a little bit to make sure that you continue to achieve the objectives, even if you have to change your operations and programming. The second lessons learned was that there is a new interest for sentinel indicators. Even if this particular crisis was a bit difficult to predict, there are so many other factors and contextual shifts that we can predict better. And it's so important to do it so we can use our monitoring system to see shifts, right? And see, okay, now something is coming up and we need to quickly correct course to be able to tackle this new crisis or disaster or contextual shift, regardless of what kind of shift there is. The third lesson learned was very important to the implementing partners. Usaid is able to shift quickly. This beast of bureaucracy can in times like this, and they have the processes and they have the capabilities, and they also have the leadership to make sure that the implementing partners are shifting and correcting course quite quickly. Sorry, Aaron, but I think that there was a perception out there that everything takes so much time, there is bureaucracy, and things are happening very slowly in Usaid. But here you can see that there have been some quick moves. And that's related to the fourth question. I think that all implementing partners and the mission also could verify that leadership is really important. Leadership and collaboration when things like this happen. So you need to be able to collaborate between the implementing partners and the Usaid and make sure that you're on the same page and quickly do those shifts that are and make those decisions based on evidence quite quickly. And with those 4 lessons to make sure that all the implementing partners can build them in to the daily work and the daily routines, the toolbox and so on, will be so important for all the implementing partners and the missions moving forward. Thank you.
Thank you, Lotta, for those great insights. We're going to move on to some questions, some that were in the chat and some that some of the presenters have come up with separately. So looking forward to that. If I could ask Paul to please spotlight all of our speakers, that would be great. And we'll head into our second Q&A. Okay, they're coming up now. Paul also noted that if you can't use the chat function or you're having any other issues, please feel free to use the raise hand feature and we can find your question that way. So this is a question for any of the presenters, and it is, what practices or adaptations do you think you're going to continue post-COVID? anyone can jump in.
Hello. From our side, we noted that virtual training has worked very well for us because we are spread across the country. So it's quite easy to do virtual training for our staff, but not just for our staff, but for other partners as well. So it's easy to do virtual training. But also we were doing remote counseling with our beneficiaries. And that means if you are pressed for time, you are still able to reach a lot of beneficiaries in a short space of time. But also the telephone processes also help you to become closer to your beneficiaries. That improves relationships. So we'll continue with that.
Thank you, Kahelo. Any other perspectives? Oh, wait a minute. I've made a mistake. Zoe Sutherland, my goodness, Senior Consultant at ITAD. I'm terribly sorry. Please, Zoe, share with us your 2-minute lightning talk and then we'll return to the Q&A. I deeply apologize.
No problem at all. Thanks,
Thank
Samantha.
you for your graciousness.
So I wanted to talk to you all today a little bit about an evaluation that we were conducting last year into the Dutch Development Finance Institution, FMO. And we had included case studies in Bangladesh, India, Kenya, and Nigeria as part of the evaluation. And they were planned to take place in person in May of last year. And then obviously all ended up taking place remotely. So for each of these case studies, we had planned for an international evaluator to be paired with an evaluator from the case study country. And we continue to operate in that way, but remotely. Luckily, the data collection was intended to be primarily qualitative through interviews anyway, and we were actually able to use video call platforms because a lot of our respondents were primarily office workers like business owners, investors, and government representatives, although there were some that we wanted to speak with that we couldn't because of this format. But I wanted to talk about 4 tips to ensure quality in these kinds of remote case studies. So first of all, we conducted the first country case study as a pilot. And because it was remote, we were able to include more consultants. And in doing so, we established a consistent approach for each of the 4 case studies, which was really important given this was a different way of working for all of us. And then my next 3 points are all about scheduling the data collection timetable. And it's to kind of account for or mitigate for the fact that we weren't in the same location together, working as a pair of evaluators. So we scheduled time within the timetable to discuss the country context. So for the international evaluator to really ask questions of the national evaluator, particularly on cultural questions like around how to do business in that country, maybe how some questions in the interview guide might be taken or responded to culturally. We also scheduled time specifically for regular remote debriefs. And we also scheduled time to review each other's notes. And this was really important for consistent note-taking for the qualitative data, but also to ensure consistent understanding and the key takeaway messages were shared by evaluators, which are kind of, all 3 of these were to make up for the time that would normally be spent in vehicles together between interviews or in the hotel at the end of the day, trying to create space for those kinds of discussions and shared views between evaluators.
Thank you very much, Zoe. And again, I'm very sorry for, I think I got caught up in the lightning talks, but I'm so glad that you've had a chance to share. I would love to go back to our Q&A, and also anyone who has questions for Zoe, please do share them in the chat so that we can ensure that she has a chance to also tell more about some of the adaptations that they made. With that, I would like to go back to that question of any other changes that you've made during COVID that you think you'll continue, if anyone else had any contributions there before we go to a couple of other questions.
I'll weigh in. I think, I highlighted an index of existing data tools or data sets, rather, that were kind of brought together to make essentially information more readily known around risks and benefits to COVID. What I think that really stresses, though, is the new and emerging data sets. We're highlighting data gaps. So while a lot of these tools that are bringing together data sets are really crucial now, it's really highlighting the some of the weaknesses within a lot of the data sets that currently exist out there, and underscores the importance for new data collection and bringing voices forward that are perhaps not captured in these existing data sets. So I think that's critically important for tools like this and Frame and others that are really kind of underscoring the importance of new data collection in addition to the existing data collection and data sets that exist.
Thanks, Mike. Any other perspectives on what you might keep going forward?
Just one thing to add. This can be used as a mitigation plan to reach the beneficiaries when we're not able actually to get into the field because of maybe the instability in the security situation or the political situation. So this can be used as a mitigation plan for future activities.
Thank you very much.
Can I add?
Yes, please.
Okay, we digitized social behavior change programs for our adolescents and young persons. And so we do interact with them on WhatsApp, and we have programs that we are sending out to them and also bulk messaging. And we think that helps us to have continued engagement with young persons on information, but also on working with them on issues affecting them on a daily basis. So we think that that would be good practice to continue.
Thank you, Kahalo. You know, there was also a question that came up around, are there any voices that are not being heard? Perhaps those the most marginalized. I know there were several comments about I'm muting myself. There is another question, another take on that, which is, are there any marginalized voices that perhaps aren't being heard because of the reliance on mobile technology? This came up in a couple of talks. So there are benefits to being able to access those kinds of tools, but they may also have other unintended consequences. So interested if anyone has a perspective on how some of these changes perhaps could be winding up limiting the kinds of inputs you might be getting from beneficiaries or others. Any perspectives on that?
Yeah, I can jump in. I mean, we've just learned, I mean, in a lot of ways, we've learned that things like training with partners, things that we used to do in person that have some benefits of being together are still being successful when being done remotely. But for us, especially when reaching some of these, again, like largely oral-based communities, remote communities in Somalia, we have had, we really haven't had direct contact. We've been working through partners. So it's removed that ability to talk to end beneficiaries directly. So that's an example of something that we know after COVID that we won't be able to replace. We won't have the richness of conversations, the access to the variety of people and representatives of the community. So those are the types of things that that we, as soon as people can get back to interacting in person, you know, and in less formal ways, that we will have to do.
Thank you, Lauren. Any other thoughts, Lemlem?
Yes. So maybe one point to mention, for example, for our youth empowerment program, we are trying to reach the vulnerable population. So when we shift this youth empowerment training to online, yes, there might be individuals who do not have access to mobile phone or internet. So what World Vision Canada is doing is identifying those vulnerable population and provide the necessary support so that they will not be left behind. And one of the adaptation that we have done is in all of our monitoring and data collection tool, we included a question to identify how COVID has impacted those population. And we also adjusting the overall project implementation to address the critical need of this population. It could include like voucher distribution, cash transfer, depending on the situation.
Thank you.
In addition, from our side in South Africa, we in the GCBS program, we also work with NPOs on the ground. So what we do is we capacitate community caregivers who are living in communities, have direct access to those beneficiaries that are out of reach. So we try to make sure that we are mitigating issues about access for those that are more disadvantaged.
Thank you, Kahela. We have a
Samantha,
question.
could I?
Yes, please.
I just wanted to add something. So this is something that has kind of niggled at me. It's a bit of a concern. So at ITAD, typically, like, we traveled a lot, generally speaking, and we have seen this as being a good opportunity to kind of reset and think again about, you know, our carbon footprint. We're actually aiming to be a carbon neutral company next year. So really thinking about like what travel is necessary and how we can do things differently. This has kind of pushed us forward, which I think has been really positive. And for instance, those case studies have been really helpful in that. But I do have this niggling concern that, for instance, in that evaluation that I was describing, we weren't able to speak to factory workers because we couldn't, in our risk assessment, we couldn't be sure that they were safe to speak to us, that they were in a safe space, that they couldn't be heard, that there wasn't a fear of reprisal for what they said. And so by its very nature, our respondents ended up being kind of more senior managers and definitely excluded some of those voices that are harder to hear. And so I don't really have an answer to that, but it's something that I feel like we are continuing to grapple with to make sure we're striking the balance between thinking carefully about what travel is necessary internationally or domestically, but also ensuring that we do hear those voices. Is just, I think it's an ongoing challenge.
Yes,
I think, Zoe, that you're also hitting the nail on the opportunity to pause and reflect, right? Because that, I think that's what all of us just had to do. You stop for a while and rethink a little bit. And what I would rather bring into next after this is basically to build those moments into it, because it's been so useful for all of us to just pause and reflect. You know, is it really necessary to travel that much? Is it really, you know, how do we have to adjust the targets more often? Do we have to, you know, do things in a different way? What's most effective when it comes to training and all of that? It's like, yeah, we've had that opportunity to do that now. Let's continue doing that because it's really useful for all of us.
I'd like to add on what Lotta is saying, because really, she also earlier said that USAID is able to shift. And I think that means we really need to be thinking outside the box when we are down there on the ground. When we find solutions that work for our local people, we need to be able to raise them and push them forward, because things work. We have been able to show that we can adapt, and with adaptation, we took it.
And they can adapt too. That's the thing. It's you know, this has told us that they have the processes, they have the ability, and if they also have the leadership, they can adapt. So I think that, you know, remembering this would also be really good for us, because it's about making sure that we together can continue to do impact, right? And certainly we found some ways to do that during these times.
With local solutions, of course.
Exactly. Yeah.
Thank you very much. All right. Mike, did you want to add something?
No, I'm good, thanks.
Okay. Wonderful. All right. Well, we have a question for Ashal, actually two, but we'll start with the first one. And the question is, how different was dealing with COVID crisis in South Sudan different than other crises that South Sudan is facing? Was there anything unique that's been done for COVID?
Thank you for that question. I think one of the most interesting things that we noted happening was good coordination to work towards the cause rather than mandate. So usually, you know, yes, there is a lot of different types of crises happening in South Sudan, whether it is food security and malnutrition or economic crisis or other types of crises, and different agencies and different development partners are coming together, working in whatever is their area of mandate to respond. But for COVID-19, it was very interesting in that everyone was working to address COVID-19, or to address how we could adapt our measures for COVID-19. So, you know, agencies like the World Food Programme, we were procuring personal protective equipment, and we became one of the largest airlines in all of Africa, moving humanitarian aid workers from one part of the continent to another. So I think what was different was that everybody was working towards a common cause, and so there was no discussions around mandates and things like that. And it also showed us that you can be, and I think other speakers have mentioned this as well, that you can be adaptable and flexible when you are really pushed to. Thanks.
Thank you, Ashal. There's a follow-up question, and this is for Ashal and or Kahelo. Can you please provide a little more information on anything that was done to verify that the beneficiaries actually received services that were reported by the community-based providers?
So yeah, we had a couple of other mechanisms in place. In addition to having WFP implement and monitor, we also have third-party monitors in place, whether they are put in place by the donor or by the government. So they were also able to check on the provision of services. Through WFP's normal large-scale distributions that we do to communities, we have toll-free community feedback hotlines that are available. And so we noticed an increase in use of this hotline for people asking for services or demanding services. So these were two ways in which we could also check if the community volunteers were either reaching the communities that they were supposed to or were providing the services that they were asked to do. Thanks.
Thanks, Ashal. Kahelo, do you have a response to that question? How to ensure beneficiaries are receiving the services?
Well, it was quite tricky, but what we were doing is we were calling primary caregivers, the parents to the children themselves when we were calling. So it was direct to the beneficiaries in a way because we couldn't call children. So, but in terms of engaging NPOs and ensuring that they make those calls to beneficiaries, that was the tricky part. It was much easier when it was our social workers doing the calls.
Thank you.
Yes.
Would anyone else like to tackle that question in terms of how to ensure beneficiaries were actually receiving services?
I think that we're going to see that become incredibly kind of important over the next couple of years with rollout of vaccines across LMICs. And that is going to take a concerted effort, both at a local, national level, leveraging the right type of MEL data to understand, what impact we're having, as well as being able to kind of undertake like track and trace from the global level as well, getting supplies to separate countries. And I think that's something that should be kind of top of mind, something that we're working on as well right now around prioritization and getting those data sets in the hands of NSOs and others to be able to kind of tackle that problem.
Thank you, Mike. Another question came up also from the presenter group, maybe taking a little bit of a step back. And it's, I think, an interesting question around, here we are in a situation that none of us had prepared for or predicted. We never imagined we would be in a remote situation like this for so long. Obviously, variability between countries, but nevertheless, circumstances that we hadn't thought would ever maybe happen. And so norms are changing. And the question is, are there malpractices that maybe had been seen as sacrosanct, or this is the way we do things? And now all of a sudden there are new perspectives on what MEL can look like. And some of those norms are shifting either in ways maybe some of you hoped for or hadn't anticipated, and it's worked out well. So curious if you move back a little bit from some of the details, when you look at how your programs are engaging in MEL practices, are things shifting in interesting ways? Are there new changes that you think hadn't been expected but are working well? Anyone's take on this question would be much appreciated. Thank you.
I can comment on that. So at least in the DRG space, I can speak to specifically, we've been using, what we call complexity aware methods for a long time. So they're more like open-ended lines of inquiry. They're not like predefined indicators. We've still, of course, for accountability purposes, set those types of indicators and targets up at the beginning, like all types of projects. But having that, I think what we've seen is it's been really helpful having those built in to see sort of some of those unintended results that we didn't expect. Some of the, like ripples that have occurred as a result of some of our work, because in some of our projects we have strayed off of our results framework a little bit because of what's happened in the past year. There's been no way around it, but it's not that we're still able to show, we're still serving our beneficiaries and we're still having intended results, just on a little bit of a different pathway towards those. So I've seen, I think that maybe in other sectors, these types of methods might become more commonplace, being integrated.
Absolutely. Thanks, Lauren.
I agree. I think that's exactly what's happening, and with the bird's eye on that, and seeing more and more implementing partners starting to talk about it, it gives us a language to talk about those factors outside our manageable interest, right? And how important those are, because you're living it right now, right? And how well prepared were implementing partners in tackling those outside factors. And then you start thinking about how do you then monitor those to make sure that you're not going to be that surprised again, right? So I think it's not only that some are doing it, it's also that it gives us a language to talk about it, to do it more intentionally for the future. And I think I can see it happens, and then we can help with some methodologies and also models of others who are doing it, because I think that some did it already very well, while some will need some more nudging and some more training in doing it.
Yeah, from our side, what I've seen is usually you find that the male team is more upfront in terms of managing data. But with COVID, we found that the programs team was very active in collecting and managing data and even analyzing it to make sense of it, to see what is happening on the ground, because that also gave them a framework to go back to see this is what we need to do in the field. So now you see a different perception about data from the programs team, which we didn't see before, which is being strengthened, and which is, I think, is a good thing, because usually people tend to separate data stuff and program stuff, and they don't see that these things are together. So we are seeing a very strong link and very strong integration in that, which really could work for us as a model of best practice.
Thanks, Kahelo. Makes me wonder, is anyone seeing other interesting examples of integration? Perhaps, Zoe, you were going to answer the question or have a different take, but is anyone else seeing some of these maybe new, cross-pollination or different ways that people are coming together in the face of COVID? Maybe people are involved in MEL who hadn't been in the past.
Yeah, so it's kind of linked to what I was going to say, which is I feel like a lot of the point so far is it's more about aligned incentives. So now all of a sudden, before maybe we have implementing partners, or we have a specific donor organization that's thinking, oh, let's give this adaptive management a try, or like, let's aim for results instead of process indicators. And now it feels like in this moment, people are more aligned towards the same thing of kind of like looking at the endpoint and understanding that the process might vary and might look different to that endpoint. So I think that's what I found interesting. And like from my perspective as well, this has also come through in terms of thinking about our clients who commission evaluations, and also, our evaluands that we're evaluating, as well as all different implementing organizations. Suddenly there's perhaps more openness to kind of thinking about these things a little bit differently, and that kind of finally we're all on the same page, whereas before perhaps people would be moving at different paces.
Thank you, Zoe. Yeah, Mike.
Yeah, if I could add, I think what we're also seeing is a lot of costs that were not explicit before, like for instance, collecting data took beneficiaries time to engage in that. And when it's an RCT, sometimes they're not even beneficiaries. And in the case of COVID, we're seeing very explicit risks, transmission risks, and it forces that conversation. Are we going to put someone at risk doing data collection for something they will not benefit from? And it kind of raises some of these other kind of questions that we had before with some of these non-explicit risks. I think it's a really healthy conversation to have of, what were these kind of other costs that we were assuming that perhaps weren't top of mind when we were doing a lot of evaluation design.
Thank you, Mike. I see a note here in the chat, participant noting that in their organization, the program staff came forth with suggestions on how to adapt remote programming because they were the ones facilitating the program. So I think this is a really interesting, to me, takeaway from this, just for my own organization in terms of, how can some of these roles that might have been perhaps siloed or, as Zoe said, maybe even not always running in the same direction, can the fact that we're all apart actually bring us more together in some interesting ways. We have just a few remaining moments here in our presentation today. There was one final question for Catherine. It's actually a follow-up from the question earlier. And this is how you consider the accuracy of your ML model.
Right. So this is a question that we get a lot. Obviously, I think with ML and knowing that these are data estimates, it's a question that's very valid. So we validate our data, comparing it to census data. And so every time that we create layers for a new country, we run a validation exercise that has to meet a threshold of 90% or more accuracy. And normally that exercise will point out some contextual differences in the country that force us to adjust what indicators we're pulling into the model to represent that contextual difference. Like modeling the Philippines is very different from modeling Nigeria. And so those validation exercises will highlight where we need to adjust and also ensure that our estimates are as accurate as they can be. And as we add to the surveys and add to the data library that we're using to create these models, our validation threshold goes a little bit higher. And also as we add to our data science team, we're a small business currently, but every time that we grow and add new talents to our data science team, our validation exercises improve. And so that threshold is constantly moving upward. But the primary way that we validate is comparing census data. There's some creative approaches that we do when we don't have that census information, but that's primarily it. And for individual countries, if there were any questions about a country in particular and how that validation exercise played out, you can reach out to me. I can answer any, because it differs by country.
Thank you, Catherine. I'd like to thank all of you for being great sports in providing 2-minute talks and for these really interesting additional comments and to the great questions that came in from the participants. Thank you all very much. To close up our event today, I'm turning it over to Josh Mandel, who's the lead for global development at IBM Services, and he's also the co-chair of the SID Washington M&E Working Group. Josh, over to you.
Thanks, Samantha. Appreciate it. And thank you, everyone. Just echoing Samantha's comments, it was a really great event. Thank you all for coming. Thank you for the speakers. Thank you for the attendees. Paul and the SID team, thanks for putting together a really smooth event today. Really appreciate it. And Samantha, you did an excellent job, pulling this all together before and today. So thank you.
Thanks, Josh.
Just a few quick follow-up points. So one is that, as mentioned earlier, we are going to send the recording from today, as well as any other supplementary material that the speakers provide afterwards. So be on the lookout for that. In that email and also in the chat, I believe that, yeah, that's right there in the chat. There's a survey provided. We would very much appreciate it if you take a look at that. The SID and the speakers put a lot of time into putting this together, and it's super fast. So just a few minutes on that, we'd really appreciate it. And last but not least, we don't want this to be the last we hear from you. We'd love, it's a great conversation. We'd love to hear if you have any, additional questions or thoughts for us. If you want to continue the conversation afterwards, you're welcome to send your resources to the co-chairs. We're actually going to include our contact information in the email, the follow-up email that we send with all of the content. So you're welcome to send ideas to us for future events. And if you have other resources that you'd like to share with the participants today, you're welcome to share those as well. So with that, again, thank you everyone for your time today. And I think that's all. Thanks a lot.
Thanks, everyone. Have a good rest of your day.